Hello students. Am I audible? Hey, am I audible guys? Fine. I hope I'm audible guys. So today this is Farre series. We are doing it for the third professional year. Okay. We are going to have some 8 classes we are going to have purely for UG university exams. Okay, fine. So we will start here with epidemiology and vaccines. Commonly you get essay questions from this topic and you get short notes. Finally, I will discuss some MCQs also from this topic. Okay, fine. Now we will start. These are the topics we are going to cover. Okay, so epidemiology in terms of vaccines and cold chain. These are the topics which we are going to cover here. Uh, First, let's start here. YouTube, I will also stream. Now, good evening, guys. Okay, fine. Now first is we'll start with this essay question. We'll start with this essay question. We will start. Define epidemiology. Enumerate the steps in a case control study. Give examples of a case control study. So you can get the notes from the Telegram group. You can get it. Okay, whatever we are discussing. And what is epidemiology? Epidemiology is, so mostly I'll try to write certain things. Study of distribution and determinants. Study of distribution determinants of health related states and events. Okay, so what is epidemiology? Epidemiology is study of distribution. Good evening guys. Okay, study of distribution determinants of health related states and events in a specified population and application of study to control the health problem. So basically it's study of distribution determinants. So it's a very commonly asked viva question also. It's a study of distribution determinants of health related states and events in a specified population. An application of this study and application of this study to control health problem. To control health problems. Okay, whatever problems we are seeing. Okay, fine. Now, so what are the steps? Okay, so this is the first. Okay, they will usually give 2 marks for this. Okay, so distribution determinants of health related states, that is epidemiology. Next step is enumerate the steps in a case control study. Right, now we will go into case control study. What is a case control study? Case control study. Okay, what are the steps in a case control study? So class will be there from 6 to good evening guys. Class will be there from 6 to 7:30. So case control study. A case control study will start from a first point, outcome to exposure guys. The case control study will start from outcome to exposure. This is a case control study, outcome to exposure. That is why it's also called as what study? It's also called as retrospective study. Okay, it goes from outcome to exposure. That is why it's also called as the retrospective study. Good evening guys. Okay, fine. Now, okay, outcome to exposure is going back in time. Outcome to exposure. What are the steps here? It will look like this. We will take the example of smoking and lung cancer. We'll take the example of smoking and lung cancer. It goes from outcome to exposure. Look here. This is the population. Okay, from the population you select cases and controls. From the population you select cases and controls. Then you ask regarding their exposure. Exposed, not exposed. Similarly, this is a exposed, not exposed. This is a case control study. This is a framework. Okay, so first is from the population you select cases and controls. Then you ask their exposure. What are the steps here? What are the steps here? Steps here. So the first step is selection of cases. Selection of cases. Purely UG exam oriented, guys. Selection of cases. Okay, you can select whenever we are selecting cases. You can select cases from general population. And second, you can select cases from hospital. Okay, I'm talking very salient points. Okay, who is a case? Case means people with disease. That is case. Case means people with disease. Okay, so case means people with disease. That is people with lung cancer, they are cases. Okay, fine. People with lung cancer, they are cases. Second. So in our example, we are talking selection of controls. Selection of controls. Select control. Who is control means what? Who is control? Control means people without disease. Okay? So people with lung cancer, they are the cases, and people without lung cancer, they are the controls. Okay, controls you can select it from general population, or you can select it from hospitals. Okay? Controls. Control means what is the criteria? Control means they should not have disease. Okay, fine. So what is this example? You can select patients, relatives can also be selected as relatives, neighbors, anybody you can select as control. Selection of cases and selection of controls. Okay, fine. Next. Third step. What is matching? Okay. Matching means cases and controls have to be similar all aspects except disease. Cases and controls, they have to be similar in all aspects except disease. Why? Because a confounding factor will affect the study. Confounding factors, they will affect the study, like age, sex. These are some of the confounding factors that can affect the study. So the cases and controls have to be similar in all aspects except disease. Suppose if you are selecting 50-year male with lung cancer, you not to write, guys. Okay, I will send the notes. Anyway, I will send the notes. 50-year male with lung cancer, the control should be 50-year male without lung cancer. That is control. Without lung cancer, that is control. Okay, fine. So this is confounding factor. Age and sex, they are the common confounding factor. Okay, fine. So this is matching. Fourth one is measurement of exposure. So measurement of exposure, you are going to ask them, are you a smoker or not? That you are going to ask. Measurement of exposure. Okay, what is the fifth step? Fifth step, you are going to do analysis. Okay, fifth step, you will be doing analysis. Okay, analysis, what will you find here? Okay, two things you will find. Okay, so fifth step, you will be doing analysis, guys. So in analysis, what will you find? In first one, what will you find is analysis exposure rates you will find. Exposure rates you will find. Second, you will find odds ratio, which measures strength of association. Strength of association, odds ratio. Okay, so what is the formula for odds ratio? AD by B. So you are going to take cases. So you have to make a 2 by 2 table, cases and controls, exposure positive, exposure negative, guys. If you have any queries, you just paste it, guys. Okay, so in the end we have MCQs also to discuss. So cases and controls. Okay, so what is this odds ratio? It will go like this, guys. A, B, C, D. So the odds ratio is AD by BC, that measures the strength of association. Okay, odds ratio measures AD by BC, that measures the strength of association. Am I clear? These are some of the steps, guys. These are some of the steps of case control study. Okay, so some famous examples are, we have taken smoking and lung cancer. Some famous examples, famous studies, case control studies. One is thalidomide disaster. Thalidomide. Thalidomide. What it cost? Thalidomide. Anyone? Can anyone tell me? What does thalidomide cost? Thalidomide. Okay, what does thalidomide cost? Anyone? The study, it's a case control study. Okay, thalidomide costs what? Yes, it costs, yes, sea limb babies, Pocomalia. That is done from this case control study. Okay, so case control study, they were able to show that thalidomide caused this sea limb babies. Second case, famous case control study is that OCP and OCP, oral contraceptive pills, and thromboembolism. Thromboembolism. This is also another famous cohort case control study, guys. Okay, case control study. Okay, fine. Yes, good evening, but I want you to answer something. Okay. So we have some good number of students are there, but I want you to answer. Okay, you want you to answer. If you have anything, you just answer it, guys. Okay, fine. These are some of the famous cohort study. Sorry, case control study. Shall I continue, guys? Are you guys able to follow? So we have completed case control study. We have completed. We'll go to the next question. Okay, are you guys able to follow me? Shall I continue? You tell me what you want. I can modify according to that. If you feel comfortable, I can continue. Yes. Fine. Okay, fine. Now, I hope this is clear. Next is classify epidemiological study designs. Yeah, this is another essay question. This is another essay question. Describe the steps in conducting a cohort study. Describe. These are all university questions, guys. These are all university questions. Describe the steps in conducting cohort studies, and they are asking strength of association. Strength of association. So what are all these epidemiological study designs? First, so epidemiological studies, we are going to divide them into observational studies. Okay, observational studies, you are going to have, one is a descriptive study, second analytical study. Analytical study. Descriptive study means only one group, guys. Analytical study means you will have two groups. Okay, fine. In analytical studies, we have further subtypes are there. In analytical studies, One is case control, cohort study, a cross-sectional study. Fourth is ecological study. A case control, cohort, cross-sectional and ecological study. For the first three, the unit is individuals. Individuals. For ecological study, the unit is population. You are doing the study in the entire population. Okay, the first three, the unit is first three, unit is individuals. You are doing the study on individual people. For ecological study, you are going to do in the population. Okay, population. These are observational studies. Second, what we have is called as experimental studies. Okay, experimental studies. In experimental studies, first is RCT, field trials. Third is community trials. Community trials. Okay, fine. Fine. These are some of the experimental studies. Okay, randomized control trial, field trial. Third is community trials, guys. Okay, community trial. Okay, fine. Now, this is the classification of study designs. Now we will go into a cohort study. We'll start with cohort study. A cohort study will start from where to where? Sorry. It will start from exposure to outcome. That is why it's called as what study? It is called as prospective study. It's called as prospective study because it starts from exposure to outcome. A case control study, we are going to say it as a retrospective study. This is the study design. Okay, this is the population. From the population, you select people without disease. Okay, fine. Then you divide them into exposed, non-exposed. Okay, then follow them over a period of time. For example, if you are taking smoking and lung cancer, you select smokers here. Okay, non-smokers. Then you go for follow them. Some will develop lung cancer, disease, no disease. Here also disease, no disease. So this is a cohort study, guys. This is a cohort study, right? Okay, so what are the steps here? That is why it starts from exposure to outcome. Okay, it takes lot of time. That is the one drawback, is that it takes lot of time. Okay, so it starts from exposure to outcome. That is why it's called as prospective study. Now, what are the steps here? First step is selection of study subjects. Selection of study subjects. You select people. Okay, fine. Second is obtain data regarding information. Headings are important, guys. In PSM, heading is important. Obtain data regarding, okay, exposure. You ask them, are you a smoker or not? You ask the question. Obtain data regarding exposure. Right? Third step. So identify a comparison group. Comparison group. Okay? You develop comparison group. Okay, fine. So it may be internal comparison or external comparison. So among smokers itself, you can divide them into people with less than 10 cigarettes per day, people more than 20 cigarettes per day. That is internal comparison group or external comparison. External comparison. हम दो ग्रुप कर सकता है. Okay, so selection of study subjects. obtain data regarding exposure, comparison group, then you do follow. So smokers, non-smokers you have taken, you are going to follow. Okay, follow up. Then fifth step, what you are going to do is that you are going to do analysis. Fifth step, analysis we are going to do. In analysis, what we can find here, okay, you are going to make a 2 by 2 table here. Okay, exposed positive, exposure negative, disease, okay, positive, no disease, disease negative, okay, disease negative, disease negative. Fine. So what we can find here, okay, you can measure like this, okay, A, B, C and D. So what we can find here, okay, in a cohort study, what we can find is incidence. We can find incidence means number of new cases. So we can find incidence. We can find in a case, in a cohort study, incidence means number of new cases which you can find in a cohort study, which you can't find in a case controls. Okay, fine. So based on the incidence, you can measure the strength of association. That was the question. Okay, what was the question here? What are the, how will you measure the strength of association? Strength of association, you can find it here. First is that strength of association. This is third component, that is you can find it with relative risk. What is the formula for relative risk? Relative risk formula is a incidence among exposed by incidence among non-exposed. Okay, incidence among non-exposed. Okay, that is strength of association. Okay, relative risk, what does it measures? It measures strength of association. Strength of association. Okay, strength of association. What is the interpretation? Both odds ratio, relative risk, both measure strength of association. Equal to 1. Relative risk equal to 1 means no association. More than 1 means it is positive association. Less than 1 means negative association. Relative is equal to 1. Okay, equal to 1 means, okay, no association. More than 1 positive, less than 1 negative association. Suppose odds ratio, relative risk both comes as 5, for example. Okay, between smoking and lung cancer, odds ratio and relative risk both comes as 5. What do you mean by that? So that means you can say that smokers are 5 times more likely to develop lung cancer when compared to non-smokers. That is the interpretation. 5 times. Smokers are 5 times more likely to develop lung cancer when compared to non-smokers. That is the interpretation. Okay, fine. So are we clear? So this is relative risk. Attributable risk we will see again. Okay, for a cohort study. Again, one more question is there. Short notes we can see it. Next. Shall I proceed, guys? Are you guys able to follow this? Enumerate the procedure in descriptive study and discuss about common source epidemiology. Again, this is a essay question. This is again a essay question. Okay, fine. Eliminate. Okay, eliminate. Enumerate the procedures in descriptive study and discuss about common source epidemic. Fine. Now, so what are the steps? Okay, descriptive epidemiology means, so you are going to do either you can do a cross-sectional study. Cross-sectional study. Second is that you are going to do longitudinal study. Longitudinal study, cross-sectional study and longitudinal study. So what is descriptive epidemiology? I already told you these studies are done in only one group, guys. Only one group. Now, so what are the steps here? What are the steps here? The steps here is, Okay, defining the population. Okay, whichever population is there, define the population. Okay, so whatever the population, wherever you are going to do the study, define the disease under the study. Whatever disease you are going to study, define it. Describe the disease in terms of time, place, and person. Describe the disease in terms of time, place, and person. Okay, fourth step is measurement of exposure. You are going to measure the exposure. Okay, so what is the exposure? Then compare it with the known indices. That is the fifth step, comparing with the known indices. And last and most important step is formulation of hypothesis. Hypothesis means idea generation. Okay, so you are going to formulate the hypothesis. Okay, etiological hypothesis. This is idea. Smoking causes lung cancer. Okay, so prolonged use of screen time can affect the speech of the baby. These are hypotheses. Prolonged use of social media usage lead to reduced performance in exams. Okay, these are some of the hypotheses. Okay, which I can generate. Idea. So these are the steps, guys. Define the population, define the disease, describe the disease, measurement of exposure, compare it with the known indices, and formulation of hypothesis. So in describing it, you are going to describe the disease in terms of time, place, and person. In time, the disease can happen in short term, periodic, or it can happen in long term. Okay, fine. Short term, periodic, and long term. In short term, disease can happen in single exposure epidemic or multiple exposure. These two we will discuss in detail. Okay? The disease can happen in single exposure epidemic or multiple exposure or propagated epidemic. These two we will discuss it. Okay, fine. Yes. Vanakkam. Fine. Now, single exposure or multiple exposure epidemics and propagated epidemics. Sometimes disease happen in seasonal. Now, respiratory season. What infection? Most of the place, rainy and winter season, more ARI, respiratory infections. A disease can happen in cycles. What is long term? Disease occurrence over a period of time. Disease occurrence over a period of time. Okay, so disease can happen in short term, disease can happen in seasonal or cyclical, disease can happen in long term. Now, just giving the outline. Place distribution, some disease, international variations. Certain diseases are common in India, certain diseases are common in America, certain diseases are common in African countries. Okay, this variation will be there. Okay, fine. More non-communicable disease, okay, in developed countries. Okay, more communicable disease in poor countries. National variation within the country. Okay, within the country itself we can see variation where you can find. Okay, for example, okay, hilly areas more malaria is common. Okay, hilly and tribal areas. Okay, so iodine deficiency some parts of India it's common. Letharism is there, it's common. Rural and urban areas. Okay, so filarias is more common in rural area, for example, if you take. Okay, urban areas nowadays we are getting more dengue. Okay, within that particular locality itself variation can happen. Okay, within the particular area, local variation. This is in terms of place. Person distribution, you are going to describe the disease in terms of age, sex, marital status. Okay, like that. Okay, certain diseases are more common in upper socioeconomic status, certain diseases are more common in lower socioeconomic status. Like that we can discuss. So you can describe the disease in terms of time, place, and person. What is the purpose of descriptive study? You are going to do the study in only one group, and the purpose is to formulate hypothesis formulation. Now the question is, what they have asked is common source epidemics. Common source epidemics you can find in single exposure epidemic. Single exposure epidemic. A single exposure epidemic. The simplest example is food poisoning. Suppose they are making a non-vegetarian food in your hostel. Okay, let us assume all of you are taking the food. Okay, so this is the epidemic curve. Time, number of cases. Okay, time and number of cases. Okay, like that you are getting exposed here, guys. Okay, you are getting exposed here. Now After some time, the number of cases increasing and it is coming down. This we call it as single exposure epidemic curve. Source is common source. Everybody is taking food at the same time. So what are the key points here? What are the key findings here? Okay, what are the key findings here? Sharp rise and sharp fall. Sharp rise in number of cases and sharp fall. All cases occur within one incubation period or more than one incubation period, guys? Okay, sharp rise and sharp fall. All cases occur within one incubation period or more than one incubation period? Yes, all cases occur within one incubation period. No person to person transmission. No person to person. So this we call it as single exposure epidemic curve. Sharply it increases and sharply it comes down. Okay, fine. This is common source epidemic. This is common source epidemic curve. Single exposure. The second one is common source multiple exposure. Multiple exposure curve. What are the characteristics of common source multiple exposure epidemic curve? Other things are same. The sharp rise will be there, then gradually it comes. Okay, let us assume the example as contaminated well is there. Contaminated well. What is contaminated well means? Okay, suppose a contaminated well is there with cholera. People are drinking water. Okay, contaminated well with cholera. Okay, what are the characteristics? Sharp rise in number of cases. Sharp rise in number of cases, but gradual fall will be. Gradual fall. The fall is also not sharp. Gradual fall. One incubation period or more than one incubation period. People are getting water at various times. Okay, so fetching water. This is more than one incubation period. More than one incubation period, guys. Okay, more than one incubation period. No person to person transmission. Okay, fine. No person to person transmission. This is common source multiple exposure epidemic curve, guys. Common source multiple exposure epidemic curve. No person to person transmission. I'm just giving outline what is absolutely needed, what I expect as an examiner when I'm correcting papers. Fine. Next question, guys. Okay, we'll go to the fourth question. Define epidemiology, classify epidemiological study designs. Okay, this we have already seen. Yes, epidemiology we have already seen. It's a common, this is also essay question, guys. Okay, essay question. Okay, classify epidemiology detail about RCT case. The question is RCT. The first two components we already seen. Okay, RCT. What is RCT? RCT, if you see one of the phases of clinical trials, it belongs to phase 3. Okay, phase 3 of clinical trials. Okay, it is one of the phases of clinical trial, phase 3 of clinical trials. What are the steps in RCT? First step is draw a protocol. What you are going to do? Absolutely. Okay. So on RCT we do on patients. Okay, RCT we do on patients. Okay, so drawing up the protocol. You are going to tell exactly what you are going to do. Okay. Selecting a reference population, experimental population. Okay, fine. Suppose I have a new drug for hypertension. Okay, who will be my reference population? Okay, so the entire experimental population, who will be my experimental population is the hypertensive. Then I will do randomization. Then I will give the drugs. Then I will do the follow-up and assessment of outcome. These are the steps. Okay? These are the steps. Okay, protocol, reference and study population, randomization, manipulation, follow-up and assessment of outcomes. My drug is working or not. This is what I'm going to do. Okay, fine. First, drawing up the protocol. This is the most important one. First, initially itself we are going to do it. Okay, so why to do it? what to do it, how to do it, all these things you are going to fix it, guys. Okay, all these things. Okay, exactly, I'm going to do this way, so what I'm going to do it, how I'm going to do it, everything is fixed. Okay, fine. Next, selecting reference population. Whenever there is a flow chart is there in the book, I want you to draw it in the exams. Okay, because that's what will fetch you marks. Okay, don't write stories. The flow chart is there, draw the flow chart. Diagram is there, draw the diagram. Okay, selecting study experimental population. Okay, experimental population, hypertensives, let us assume hypertensives are my study population. Okay, the whole hypertensives in the world is my reference population. So I will access for some amount of hypertensives near to me. These are experimental population. From that I will select a sample. Okay, I will select a sample after inclusion and exclusion criteria. Okay, so based on the inclusion exclusion criteria, I will certain people will be there, certain people will not be there. Then I will use a technique called as randomization. I'll use a technique called as randomization. Using randomization, I'm going to divide them into treatment group and control group. Treatment group and control group. Okay, fine. What is randomization? I'll make a lot. The lot I'll put all people's name, and I will select one people. This person will go to treatment group and this person will go to control group. Okay, so first person treatment group, second person control group. So actually, what is the advantage? It eliminates selection bias. Okay, it eliminates selection bias. It will eliminate. Then what you are going to do? You are going to follow the people. Then you give the drug A, drug B, then follow up. Then over a period of time, you can compare it. Compare manipulation. Okay, drug A, drug B, eliminate selection bias, treatment group and control group, drug A and drug B. Then you can compare it, guys. Okay, this is what is this called as? Okay, so this is RCT, guys, randomized control trial. And the most important step is randomization, which is the most important step here. That is randomization. Now, what is randomization? Randomization is it's a statistical procedure, okay, by which participants are allocated into study and control groups. Advantage is that, okay, who will receive drug, who will not receive drug. Okay, so what is the advantage? It eliminates selection bias. Okay, it eliminates selection bias. Okay, it eliminates selection bias. Second point is that it ensures comparability. It eliminates selection bias and it ensures comparability. It ensures comparability between the group. That is the advantage of randomization. So what is the result you will get? Okay, so when you're doing analysis, okay, suppose the drug is A drug is better than the B drug. These are positive benefits. Okay, so positive results means, okay, the new drug reduces incidence and severity of disease. That is positive results. What is negative results? Negative results means, okay, severity and frequency of side effects may happen. Okay, some drugs can produce side effects. Okay, so positive results in terms of reduced incidence or severity of disease. Negative results can also happen. Okay, so whatever the new drug I am taking, I am checking with the existing drug. Okay, so what will happen? The new drug is having more side effect, then it becomes negative. Negative results also can happen. Now, whenever you are doing in analysis, okay, fine, assessment, okay, there are some bias can happen. Okay, in terms of subject observe evaluation bias, this can be eliminated by blinding. The blinding itself can act as a short note for you. Okay, so what are the different types of blinded studies are there? Single blind trial, second double blind trial, third is triple blind trial. Single blind, double blind and triple blind trial. Single blind means patient does not know which treatment he belongs to. Whether treatment group or control group, patient does not know. Double blind means when patient also doesn't know, and doctor, the person who is conducting the study. Suppose I am conducting the study, I will also don't know who is the treatment group and who is the control group. Triple blinding means patient, doctor, analyzer, all three will not. That we call it as triple blinding. Okay? So ideal one is triple blinding is the ideal one, the ideal and best. Most commonly used is double blinding. Double blinding is the most commonly used. Triple blinding is the ideal and best. Okay. Analyzer, patient, doctor, all three will not. Are we clear, guys? Shall I continue? So far we have seen 4 essay questions, guys. Okay. Descriptive studies, case control, cohort and RCT. Shall I continue? Are we clear? Okay, fine. Now, so this is now this is the fifth essay question. This is the fifth essay question from this topic. One more essay question we have added here. Now, so in a village of 5,025 cases of acute diarrheal disease was reported. Okay, so the entire village receives water supply from overhead tank. There is no history of common source of food intake. History of pipe leakage near overhead tank is present. Pipe leakage. Okay, this what they are asking here is define epidemic. Okay, fine. List the objectives of epidemic investigations. How will you conduct the outbreak investigation? That is the question. Okay, they want you to conduct an outbreak investigation. This is again an essay question. Fine. So what is epidemic? Epidemic means unusual increase in number of cases in excess of expected frequency. Okay, unusual increase in number of cases in excess of. Normally some cases will happen. Suddenly there is unusual increase in number of cases. This is epidemic. If they are asking like this, you have to answer it, because this alone will have 2 marks. It will. Okay, fine. Define the magnitude of the epidemic outbreak. Okay, so what are the objectives? These are the objectives. Okay, objectives. Okay, the first objective is that define the magnitude, how big the epidemic is there. Okay, magnitude, fine. And to determine the factors responsible for the outbreak, why this outbreak has happened. Outbreak means small form of epidemic. Then third thing is that to identify the cause, what is the reason, source, okay, modes of transmission, how this is transmitted, and how to control the epidemic. That is the step 3, how to control, and make recommendations to prevent the reoccurrence, guys. Okay, to make recommendations to prevent reoccurrence. Okay, so these are the objectives, guys. These are the objectives. Okay, how big the epidemic is, the reason why it has happened, what are the modes, so that I can control and prevent the reoccurrence. Now, what are the steps here? Steps. Okay, let us assume this is cholera. Let us assume it's a cholera. The first step is that, okay, what is the first step? First step is that verification of diagnosis. Is it really cholera? The question, what was the question is acute diarrheal disease. So you make a test. Okay, so test. So for cholera means what is the test? Either clinical examination or microbiological examination to it confirm. Second step, what is the second step? Confirmation of the existence of the epidemic. Confirmation of the existence of an epidemic. You just compare with the previous year's data. Okay, compare with previous year's data. Then we will know that whether this is an epidemic or constantly this much case is there. So you compare with the previous data and you have to look for whether there is unusual increase is there. Okay, unusual increase is there. That you have to compare. Okay, fine. So then define the population. This is the third step, guys. Defining the population at risk. So check the map, obtain the map of the area. Okay, fine. Okay, which are the houses are there? Then counting the population. How many people are there in the area? To count it. Defining the population. Okay, fine. Suppose the village is there. So make a map of the village. Okay, then you count it. How many people are there in that village? Then you do survey. Okay, fine. You do survey. You check for. Okay, go house to house. Search for cases. Okay, so how many people are affected? The family. Searching for more cases. Okay, go house to house. Go to house. Check, collect data. Okay, is there any of the family members having diarrhea? You make a case definition and okay, diarrhea with this many episodes, like that case definition. Then you do the survey. Then what you do? Data analysis. Already we have seen that epidemic curve. You can make a curve, you can make it. Okay, fine. Epidemic curve. Then you can make a spot map. Is there any particular area the disease is more common? Suppose the village may be very big. Okay, or the cases are happening throughout the village or a particular place of the village, you have to check. Okay, the famous example is John Snow. He was able to show that in 1850s, cholera is transmitted by water. Nobody knows what is cholera, how it is transmitted. 1850s itself. That is spot map means you make the map of the particular area in which are the houses, which are the area cases are clustered. Then you do person analysis, age wise, sex wise, you can do data analysis. Then formulate hypothesis. Hypothesis means idea. Why this epidemic happened? Okay, idea. Okay, idea in terms of what is the possible source, what is the agent, what is the modes of spread, and what are all the environmental factors. Okay. In that question, what we have seen is leakage of pipe. Leakage of pipe. So what was the reason? The leakage of pipe, the drinking water is mixed with probably with the sewage. With sewage mixture was happened. Probably. Okay, probably. That is the reason for this epidemic. Okay, sewage is mixed with this pipe water. Fine. Then test your hypothesis. Usually, so you can select the, you can do case control study. Okay, you can do a case control study. Okay, you select cases. Cases means people with diarrhea. Control means people without diarrhea, cholera or whatever diarrhea. Then ask what is the source of your water supply. Okay, the people without diarrhea may say that they are having source from other place, other water supply. Okay, fine. Test your hypothesis. Then evaluation of ecological factors. Go there and check, is there really pipe has been mixed, broken, and does it there is a mixture of sewage with the drinking water has happened. You go and check it. Evaluation of ecological factor. Further investigation of population at risk and writing the report, guys. The final step is writing the report. Okay, so what are the steps here? So first step is that verification of diagnosis. Then what you do is that confirmation of epidemic. Then you go stepwise. What is the third step? Defining the population at risk. Then fourth step is rapid search for cases. You do the data analysis, do the descriptive study. Then what you are going to do is that formulate hypothesis, test hypothesis, ecological factors, you do it. Okay, so does it supporting your hypothesis? Okay, then what you can do is that writing the report. Okay, fine. So are we clear? Okay, so are we clear? Okay, any queries here you can ask me. This is okay, outbreak investigation. This is outbreak investigation. Fine. This is the sixth question. This is also an essay question. This is also an essay question. Classify acute events, AEF, I guess, adverse or acute events. Okay, following immunization. Describe the steps in investigation of AEF, adverse events following immunization. First is, what is this AEF, adverse events following immunization? This is an untoward medical occurrence following immunization which does not necessarily have a causal relationship with the usage of vaccine. Okay, so some event has happened, medical occurrence, okay, and need not to be have a causal relationship. Okay, that need not to be a cause for this usage of vaccine. We can broadly divide them into 5 headings. Okay, first itself is because of vaccine itself. Vaccine can cause this. vaccine related, or defect in the vaccine can cause this, or defect is immunization, you are giving vaccine, okay, that injection may be related with that, okay, anxiety, or purely coincidental, purely coincidental. These are the 5 headings, reasons for AEFI. Now, vaccine reaction, okay, the first two, because of the product related or because of quality related, product or quality itself, okay, quality. It can be broadly classified into minor reactions and major reactions. Okay, these are some of the minor reaction. Okay, the pain, swelling, local reaction can happen, guys. Okay, BCG can cause, DPT can cause, hepatitis can cause. Okay, these are minor. Okay, so pain will be there, swelling will be there. Okay, DPT and all, very commonly it can cause fever. Okay, very commonly it can cause fever. That is why we have to give what? Paracetamol whenever you are giving. Okay, this DPT. Fine. Next, what is rare and serious? For example, measles can cause thrombocytopenia. Okay? OPV can cause this vaccine associated paralytic polio, VAP. Okay? That is because of this type 3. So OPV has 3 serotypes are there. The type 3 can cause this. DPT can cause this. Okay, persistent inconsolable screaming. Okay? The baby will be keep on crying for more than 3 hours. It will keep on crying. Okay? Hypotonic hyporesponsive episode. These are DPT, guys. These are DPT can cause. Okay, so BCG rarely it can cause this osteitis, suppurative lymphadenopathy can cause. Tetanus can cause brachial neuritis. These are some of the serious reactions. These are some of the serious reactions. Following this serious reaction because of the vaccine itself or the quality. It may be immunization, error in handling the vaccine. Okay, so non-adherence. Okay, suppose you are supposed to give this diluent, okay, wrong diluent, error in administration. Okay, so you are supposed to give subcutaneously, you are given it as IM. Okay, you are given it as intradermally. Okay, the route has been not followed. Okay, or the diluent is for BCG you have to use normal saline, you have mixed it with what? Okay, so you have mixed it with the distilled water, such type of things. Or it may be related with anxiety, guys. May be related with anxiety. Fainting very commonly happen. Very commonly happen. Okay, so patient become pale, hyperventilation because of this stress is related with the vaccine itself. Vaccine giving that injection because of the injection, or it may be purely coincidental. Okay, so there may be a disease which is totally unconnected with the immunizing agent. Okay, fine, so totally unconnected. Okay, so already the patient is having some form of organism. Okay, just because of the vaccine it shortens incubation period and suddenly the person develops disease. Okay, this is coincidental. Okay, so 5 headings we have seen. It may be related with vaccine, vaccine quality, okay, or product. Okay, so immunization related, okay, stress related, or 5th one is coincidental. Okay, coincidental. How will you investigate it? How will you investigate? Okay, so obtain patient confirmation, confirm the information. Whenever you are getting a case, okay, you go there and get the data, investigate about the patient, about the event, about the suspected vaccine, about other people. Okay, so is this only child is having vaccine, or there any other child from the same place who are vaccinated having the reaction or not? Okay, you go there and investigate and collect the data. So assess the services. Okay, fine. Then you have to check that whether vaccine storage is it happened properly, whether distribution of vaccine has done properly, whether disposal how it's done. So whether these people are trained or not. Suppose you are going to a PHC. Okay, so this is where it is happened. Okay, you go there, check everything. Okay, so everything is as per order. Is there some problem? Is there? Then you develop hypothesis. Hypothesis means why this happened. Then test the hypothesis. Try to test it and conclude the investigation. Conclude the investigation. These are the headings. These are the headings you are going to write. Okay, whenever you are writing question, make sure that you write the headings properly. Okay, fine. Even if you are writing it, okay, heading, okay, that should give you marks. That should give you marks. So confirmation, go there and investigate it. Okay, then you find the services. Okay, are they storing the vaccine properly, distributing this, training, everything? Then formulate hypothesis, test hypothesis, conclude investigation. We'll go to the next question. Is it fine? Shall I continue, guys? Shall I continue? So far, we have seen 6 essay questions. We will see 9 short notes. We will see, guys. Then we will see some MCQs. This is short notes, guys. This is short notes. Okay, so you will get this 5 marks questions. So write the national immunization schedule. Okay, fine. So at birth, what is the vaccine you are going to provide? BCG, OPV 0 dose. Okay, and hepatitis B. Okay, just revision, guys. It should be revision for you. Okay, just listen. At 6 weeks. Okay, 6 weeks, what you are going to see? 6 weeks. At 6 weeks, you are going to provide pentavalent 1, OPV 1, rotavirus 1, IPV 1, PCV 1. What is pentavalent means what? What comes in pentavalent? 5 conditions should be there, guys. Okay, pentavalent should be there. 5 conditions. Okay, so DPT will be there. Then diphtheria, pertussis, tetanus. Okay, H influenza B and hepatitis B. 10 weeks. 10 weeks. Pentavalent 2, OPV 2, rota 2. Okay, PCV means pneumococcal. Pneumococcal. 14 weeks. Penta 3, OPV 3, so rota 3. Next is IPV 2, PCV. IPV and PCV will provide at 6 and 14 weeks only. 6 and 14 weeks. Okay. IPV. At 9 months, what will you provide? MR1, JE1, vitamin A, guys. MR1, JE1, vitamin A. Then what else we will have? We also will have IPV and PCV booster. Okay, this is 9 months. 16 to 24 months. What you are going to provide? MR2, JE2. MR2, JE2, and you will be providing DPT, OPV booster dose. DPT and OPV booster dose. DPT and OPV booster dose. 5 to 6 months. 5 to 6 months you will provide DPT. 10 years, 16 years pregnancy. You will be providing PT or T. Tetanus, okay, tetanus, okay, diphtheria and tetanus. Diphtheria in low doses. Okay, so this is a short note for you. Okay, these are the vaccines you are going to provide. So 10 years, 16 years pregnancy. So we don't provide tetanus. We will be providing TD. Okay, not tetanus alone is not given nowadays. We are going to provide DT. Okay, fine. Short notes, guys. We are studying short notes. What is cold chain management? Next, this is also short note. Here afterwards short notes. So cold chain, we have to maintain the temperature of vaccine. The ideal temperature should be +2 to +8 degrees Celsius. This is the ideal temperature. So you have to maintain the temperature 5 to 6 months. Okay, sorry guys. Okay, this is not 5 to 6 months. This is 5 to 6 years. 5 to 6. 5 to 6 years it is DPT, guys. 5 to 6 years it is DPT. So Jai Balaji is active. Fine. Next. So cold chain management +2 to +8 degrees Celsius. +2 to +8 degrees Celsius. Okay, right from manufacturer. Right from manufacturer, we have to take the vaccine. Right from manufacturer, we have to maintain the temperature of the vaccine. Okay, then it will come to a place called as walk-in cold room. Okay, walk-in freezer or walk-in cold room. Okay, it will come where the entire room they will maintain the temperature, they will maintain. Okay, walk-in freezer or walk-in cold room. Okay, this is ideal. Then where the walk-in this will be there at regional level, guys. Okay, this will be there at regional level where they will store the vaccines for 4 to 5 districts. Then the vaccine will go to a place called as, okay, manufacturer walk-in cold room. Then the vaccine will be taken to district level. District level you will have deep freezer and ILR, guys. Okay? Ice lined refrigerator. Deep freezer and ILR, ice lined refrigerator we will maintain. Walk-in cold room at district level, deep freezer. Then you will have PHC, vaccine will be brought to PHC level. The PHC level also will have deep freezer and ILR you will have. Okay, so the deep freezer and ILR, that is a PHC level. Then finally the vaccine will go to village level. This is usually common things. Usually will go to village level. Okay, usually in village where the vaccination will happen, vaccination will happen in a place called as Anganwadi. Yeah, Anganwadi, where they will have this vaccine carrier. The vaccine carrier. They will have this vaccine carrier. Okay, deep freezer and ILR. The PHC usually will store the vaccines in ILR days. In PHC, where will you store the vaccines? A commonly asked MCQ. Okay, even in university exams, I saw this question. Okay, so this is ILR base. In Anganwadi, it's vaccine carrier. Okay, vaccine carrier. Okay, other structures will be there. Cold box will be there. Other things will be there. But these are the more commonly used one. More commonly used, right from manufacturer to village level. So what is this? This is called as ILR, guys. These are the images of ILR. Ice lined refrigerator. The temperature will be +2 to +8 degrees Celsius. This is ILR, ice lined refrigerator. +2 to +8 degrees Celsius. This is vaccine carrier. This is vaccine carrier. Okay, vaccine carrier. How many students? How many ice packs are there? Yes, it will have 4 ice packs. Okay, 4 ice packs are there. And how many vials we can store? 16 to 20 vials. Okay, 16 to 20 vials you can store. 16 to 20 vials. This is ILR, ice lined refrigerator and deep freezer. In a PHC, you will always use ILR base for vaccine store. PHC. PHC you will use this ILR you will use for storing the vaccines. Storing the vaccines. Next question, guys. Hope this is clear. So the next question is, this is also a short note for you. Explain any 5 Hills criteria for association and causation. This question is related with Bradford Hills criteria. This question is related with Bradford Hills criteria. Bradford Hills criteria. Okay, so this is for association and causation, especially for non-communicable disease. Especially for non-communicable disease. For example, I want to use, okay, I want to show, because for communicable, non-communicable disease there is no agent. Okay, if I want to use a tell as a risk factor for non-communicable disease, okay, it should try to fulfill this criteria. For example, let us take smoking and lung cancer. Another short note for you. This is another short note: smoking and lung cancer. Fine. These are the criteria. Bradford Hills criteria. I want to prove whether smoking is an important risk factor for, okay, lung cancer. Okay, the first one is temporality or temporal association. Heading is important here. Strength of association, consistency, specificity, biological plausibility, and coherence, guys. Fine. First, what is temporal relationship? Temporal relationship is, I have to prove that cause preceding effect. cause preceding effect. That means I have to show that, okay, in smoking lung cancer, first smoking should come followed by lung cancer. Okay? So this is cause preceding. तो पहला cause होना चाहिए, उसके बाद okay relation, that is effect, that is smoking followed by lung cancer, and it is the most important criteria. Okay, most important criteria. Which study can prove means in between case control and cohort study, it will be cohort study. Second, what is the strength of association? Okay, fine. Okay, strength of association. More the number of cigarettes, does it lead to more the risk of lung cancer? That is strength of association. More risk, more the exposure, more the risk. That is strength of association. Third, specificity of association. This is one-to-one association. Okay, smoking should only cause lung cancer, and lung cancer should only be caused by smoking. Okay, so this is the most difficult criteria to prove. Okay, because smoking causes so many other things. Okay, but that is the difficulty we are facing. Okay, in proving that smoking causes lung cancer, but cigarette is made up of lot of particles. This is the most difficult criteria to prove, guys. Most difficult criteria. This is the most difficult criteria to prove. Biological plausibility. Changes at cellular level. Changes at cellular level. If a patient died with lung cancer, if you do the post-mortem, you can see what are the various changes are happening. Okay, what are the various changes are happening at cellular level, you can find it. Okay, so a patient with lung cancer, cellular level, because of the smoking. Okay, tar particles may be there. Okay, so that has to be proven. Okay, fine. This is biological plausibility. Consistency of findings. Okay, various studies throughout the world should say. Okay, I should not be the only person should say this. Okay, smoking causes lung cancer. Okay, studies in India, studies in abroad. Okay, various places they should able to say that. Coherence of association. What does it mean? So this indicates increased smoking lead to increase in lung cancer. Okay, so increase in smoking, for example, cigarette sales. Okay, cigarette sales. Okay, that should not come in opposite way. When there is no cigarette, okay, there is less lung cancer. Okay, but when the cigarette sales gradually increase over a period of time, okay, there is increase in lung cancer. Okay, this we call it as coherence. Okay, the most important criteria is temporal association, and the most difficult criteria is that specificity of association. Discuss some bias in epidemiological study. It can happen in case control study, cohort study, also it can happen. So the first one is, okay, let's see, recall bias. This happens. Okay, so you are asking cases and controls regarding their exposure. What are the steps in a case control study? Okay, first you are going to select cases and controls. You are going to ask them, okay, do you expose to this? Who will remember better? Okay, people may not remember, guys. Okay, people may not remember. Okay, do you remember what you studied last week? Do you remember what you ate last week? No? Okay, we don't remember. Okay, similarly, people will forget. So that is recall bias. Some will remember, some will not remember. The information what they are giving, that is wrong. So what is bias means? Bias means any systematic error. Whenever we are doing research, any systematic error is happening, this we call it as, okay, recall bias. What will happen? The person is not remembering. He may be exposed. He is not remembering. Then there is an error in information. Second is that Bergsonian bias. Bergsonian bias. This happens because in hospital-based studies, okay, if you select your participants, okay, only from hospital, this bias can happen. Okay, Bergsonian bias. If you select your participants only from hospital, this bias can happen. It's a type of selection bias. Okay, it's a type of selection bias. Okay, people admitted in hospital, you are selecting them for your study. This bias can happen because a person admitted in a hospital, for suppose you want to select a people with diabetes. The people with diabetes in the hospital, the people with diabetes in the community, are they same or they different? Most likely they are different because The people who are admitted in the hospital means they are having multiple comorbid conditions. That's the problem. Third one, interviewers bias. Okay, interviewers bias. This happens because of unequal interviewing time, guys. Unequal interviewing time. Okay, you are giving more time for cases. Okay, suppose for example, cases you are giving 60 minutes for interview. Okay, controls you are giving only 10 minutes. So you are giving more time for cases and less time for control. This is interviewers bias. Interviewers bias. Fourth one. Okay, this is a confounding bias can happen. Confounding factors. Okay, confounding factors can cause this bias. Confounding bias can happen. Okay, so for example, for example, high altitude and goiter. High altitude is causing goiter? High altitude is causing goiter? No. Okay, so this bias can happen. It's not the high altitude that is not causing the goiter. That is because of iodine deficiency that is causing goiter. This type of bias, this is confounding bias can happen because the bias is because of a confounding factor. Age, sex, they are also come there. Okay, fine. So these are the different types of bias, guys. Okay, this is also a short note for you guys. Short note. Next, what is the difference between a case control study and cohort study? What is the difference between a case control study and cohort study? Yes, a case control study will start from case control. This is case control. This is cohort. A case control study start from outcome to exposure. Cohort study will start from exposure to outcome. Okay. Which one takes more time and more cost? This takes less time, more time. This is more. Less cost, more cost. What is the main problem in a case control study? Main problem in case control study is recall bias. Okay. Loss of follow. Okay. Loss of follow. Okay. So what is, you are starting the study, you have to follow the people over a long period of time. Loss of follow. Okay. Also called as attrition, guys. Also called as attrition. Start of the class, how many people were you? Okay. Now gradually it's coming down. Okay. This we call it as loss of follow. Recall bias, loss of follow. Next, this is recall bias and loss of follow. Case control study is useful for rare disease. This is useful for rare exposures. Okay, cohort study is more useful for rare exposure. Case control study, rare disease. Multiple outcomes can be studied. This is multiple etiologies can be studied. So I am doing a case control study, smoking, lung cancer and smoking. What are the possible other causes for lung cancer I can study? Maybe asbestos exposure apart from smoking. Okay, multiple etiologies can be studied here. Multiple outcomes can be studied. Okay, I am following smoking and lung cancer. I am following people, smokers and non-smokers. Okay, smoking not only going to cause lung cancer, it can cause emphysema, can cause bronchitis, renal cell cancer, esophageal cancer. Multiple outcomes can be studied. So are we clear? Shall I continue, guys? Yes or no? Discuss in detail about relative risk and attributable risk, guys. Okay, discuss in detail relative risk and attributable risk. Relative risk already we have seen. Shall I continue? Relative risk is already we have seen. Incidence among exposed by incidence among non-exposed. Okay, incidence among exposed by incidence among non-exposed. Already we have seen. Okay, so equal to 1, no association, more than 1 positive association, less than 1 negative association. This is relative risk. What is attributable risk? Attributable risk. Okay, attributable risk. Okay. So this is attributable risk. Attributable risk is, okay, attributable risk, incidence among exposed, incidence among exposed minus a incidence among non-exposed divided by incidence among exposed multiplied by 100. Okay, multiplied by 100. It comes in percentage, guys. It comes in percentage. Okay, incidence among exposed minus incidence among non-exposed by incidence among exposed multiplied by percentage. Okay, what does it mean? Okay, how much percentage of disease? Okay, how much percentage of disease attributed to the exposure among exposed? Suppose smoking and lung cancer comes as 90 percentage. What do you mean by that? Okay, so 90 percentage of lung cancer among smokers is because of. So what is the percentage of disease? How much percentage of disease attributed to the exposure among okay, fine. Let me check it. Okay, I will let you know tomorrow. Okay. So how much percentage of disease attributed to the exposure among exposed guys? Okay, fine. What is isolation and quarantine, guys? Okay, isolation is quarantine. Okay, so isolation and quarantine, these are purely exam questions which we have taken from university website. I have taken. Okay, fine. What is isolation means? Okay, isolation, I'm just giving crisply, guys. Okay, isolation, we do it on patients. Quarantine, we do it on exposed person. Okay, isolation we do it on cases, guys. Okay, what is isolation? Isolation we do it on cases. Quarantine we do it on exposed persons. Will do exposed persons will do. Okay, fine. So what is this? How long will you do the isolation? Isolation you will be doing it for during the period of communicability. Okay, isolation we do it for period of communicability. For example, okay, you want to for measles case. Okay, the period of communicability is 4 days before and 4 days after the rash. Okay, what about this one? Okay, we for example, this is measles is like this. Okay, suppose rubella is 7 days before and 7 days after. Okay, this is quarantine should be the longest incubation period. Longest incubation period. Okay, for example, if you take, okay, quarantine, the longest incubation period, for example, if you take this yellow fever, okay, 3 to 6 days, so 6 days should be the quarantine period. Okay, for COVID, how much is the incubation period? Okay, COVID, it's 2 to 14 days. Okay, quarantine should be 14 days. Okay, the longest incubation period. Longest incubation period. What is attack rate and what is secondary attack rate? Okay, so what is the formula for attack rate? These are also short notes for you. Attack rate and secondary attack rate. Number of new cases a particular time period for the month of May, for example, by population at risk multiplied by 100. Okay, so what is this attack rate? Attack rate means we'll use it during outbreaks. Disease outbreaks. Suppose a village is there. In that village, how many people got the disease? How many people? Okay, how many people are there in the village? Okay, how many people got the disease? This is attack rate. It is expressed in terms of percentage. It is expressed in terms of percentage. We'll use it during disease outbreak. What is secondary attack rate? What is secondary attack rate? Number of new cases developing within one incubation period of exposure. Okay, number of new cases developing within one incubation period of exposure. Okay, so number of new cases, denominator is total number of susceptibles. Total number of susceptibles among exposure. Not everyone, guys. Multiplied by 100. The number of new cases developing within one incubation period of exposure. Denominator is total number of susceptibles among exposure. Not everyone, susceptibles. So this is secondary attack rate. Secondary attack rate, what is it? It's a measure of communicability. Measure of communicability. Okay, secondary attack rate is a measure of how infectious is the condition. Okay, for example, pertussis 90%. What do you mean by that? If 100 susceptible children are exposed, 90 children can develop pertussis. That is what the interpretation. Okay? So pertussis, that is whooping cough is 90%. What do you mean by that? If 100 susceptible children are exposed, 90 children can develop. Number of new cases developing within one incubation period. Denominator is total number of susceptibles among exposed. This is the last theory question. After that, we have MCQs. What is a primary case and what is a index case? What's a primary case and what's a index? So what's a primary case? This we will calculate during disease outbreaks. Okay, disease outbreak. Suppose a village, there is a disease outbreak is happening. This we will calculate. What is the primary case? Primary case means first case in the community. First case in the community. That is primary case. The first case that has come to the community. What is the index case? Index case means first case to the health provider. The first case which came to the health provider, that is the index case. Okay, the first case in the community is called as a primary case. The first case which came to the health provider or doctor, that we call it as index case. We call it as index. Let's see some MCQs, guys. Let's see some MCQs. Try to answer it. This topic we didn't touch it today, but you can answer. Direct standardization is used to compare. These are university MCQs, guys. Direct standardization used to compare mortality rates between countries. This is done due to difference in what? Try to answer it. Answer. Just check whether whatever right you are saying is fine. Crude rates we cannot compare. Try to put it there. Crude rates we cannot compare it, guys. Okay, crude rates we cannot compare. Why? That's why we do standardization. That's why we do standardization. Others, Kushi is doing. What about others? Okay, direction is to compare the mortality rates between the countries. What is the purpose? Because of difference in what? Difference in age distribution. Cannot compare it, guys. Okay, so because difference in age distribution. Incidence is calculated from. This one you can answer it. Which study can calculate incidence? Incidence means number of new cases, guys. Which study? Which study can give this incidence? Second question. This is second question. Okay, question number 2. Incidence can be calculated from which study, guys? Okay, which study can calculate incidence? Incidence means number of new cases. Okay, the case control study, retrospective study and all we cannot find. Okay, which one we can find? Yes, we can find only in prospective study, guys. Prospective study. Third question. Try to answer it, guys. Whether it's right or wrong, no problem. Just try to answer. At PHC level, vaccine storage is by PHC level vaccine storage. Okay, fine. Where will you store the vaccines? At PHC level. PHC. Today, I think we have discussed this. Where will you store the vaccine? You will store the vaccines in which one? ILR, guys. Ice-lined refrigerator. ILR. Ice-lined refrigerator. Fine. PHC, you can store the vaccines in ILR. Which of the following is a better indicator for severity of acute disease? Severity. Question number 4. Okay, question number 4. Which of the following is better indicator of severity of acute disease? Severity. Severity also we can say it as what? Okay, fine. Or killing power of the disease we can think. Okay, killing power. Specific death rate we cannot say. Okay, killing power. Acute disease. We are looking in terms of acute disease. Okay, what is the answer here is what? You can answer it. The answer here is what? It is case fatality rate. Case fatality rate. Survival rate will estimate prognosis, guys. That will estimate prognosis. Case fatality rate. Case fatality rate. That will tell you virulence. Virulence or killing power. This will tell you virulence or killing power, guys. Virulence or killing power, it will tell. Cross-sectional study is what? Cross-sectional study. Today I'm checking your blood pressure, guys. Okay, trying to find out how many of you are hypertensive. Only one time I'm checking your blood pressure. Cross-sectional study will give you what? Okay, cross-sectional study will give you what? Longitudinal study will give you incidence. Cohort study and longitudinal study will give you incidence. What does cross-sectional study will give? Yes, cross-sectional study is a prevalence study. Cross-sectional study is prevalence. Prevalence. You can find prevalence. Okay, what is prevalence? Old plus new cases. Okay, both old plus new. Okay, that is prevalence study. Prevalence. True about point source epidemic. Today we have seen this. Okay, which one is true here? True about point source epidemic. Which one is true? Which one is true? True about point source epidemic. Point source epidemic means single one. Fine. Yes. Try to answer, guys. Okay, try to answer. Okay, occurs more than an incubation period. Exposure is continuous. False. No. What is it? Not more than one incubation. Point source means single exposure. This is wrong. Only one exposure. This is also sharp rise and sharp fall we have seen. This is occurs in one incubation period, guys. Occurs in one incubation period. The first person becoming sick in an epidemic is called as. The first person becoming sick. So now only we have seen this. The first person becoming sick in an epidemic. Sick in during epidemic, during outbreak. Yes. Is it a primary case, index case? What is this? The first person becoming sick, we are going to call it as primary case. Okay, index case means the first case came to the health provider, guys. That is index case. This is primary case. Primary case. Okay, fine. All of you answering nicely. If a drug prevents mortality but does not affect cure, then which of the following will be? So this is the relationship. Okay, prevalence is equal to incidence into duration. This question. Prevalence is equal to incidence into duration. If a drug prevents mortality but does not affect cure, okay, what will happen? Okay, this is the next question, guys. Okay, fine. Incidence is not affected by duration. What does it mean? A drug prevents mortality but does not affect cure means what is going to happen? There is going to increase in duration. It's going to increase. If there is increase in duration, incidence is not affected by duration. What will happen? Prevalence will increase. Prevalence will increase. At the end of year 2000, the population of a tribal district was 2 lakh. Number of cases of TB was 800. At the end of 2001, the population was this much. Number of new cases was 200 detected. 12 cases have died. Based on this data, all of the following rates can be calculated except this. All of the following rates can be calculated except. A good question. Okay, you are having an old case you are having. New case you are having. 12 died. Now tell me all can be calculated except. What is the answer? All can be calculated except. Since old case is there, a new case is there, you can find this prevalence, you can find good prevalence, you can find. Incidence is there. It's a new case that also you can find. So 12 cases died. We know the total number of cases. This is also you can find. Okay, that is case fatality rate also you can find. Proportional mortality rate, what is the formula? Suppose for example, EB divided by you require total deaths multiplied by 100. We don't have the value of total deaths. This one is not there. The total deaths we don't have. So the answer is proportional mortality rate. EB divided by total deaths. So we have completed. You can use both Cushy for your studying. Okay, this I'm giving some more updated things for you. Okay, thanks for listening. And tomorrow we will go with concept of health and disease screening and other chapters. Okay, so this is more exam oriented. Okay, there is no questions. Okay, thanks for listening. See you tomorrow, guys. Every Monday, Tuesday, community medicine classes will be there. Every Monday, Tuesday. Okay, so the link I will this PDF I will send it to the Telegram channel. Okay, you can collect it from there. Okay, thank you. Tomorrow we'll see, guys. Tomorrow we'll see. Thank you.